Good morning, everyone. Oh, wow. Good morning, everyone. All right. My name is Talisha Hodge Thompson, and I am the Account General Manager and Technical Director for Gainwell Technologies. And I am super excited about being here today in Tifton, Georgia. What a drive. Yeah, exactly. So just because I want to make sure that everybody is just as excited as I am, I'm going to call out the organizations. I'm going to say good morning, and I want you to give me a good morning back. How about that? All right, let's go. Good morning, Gainwell Technologies. Woo, I'm going to need to hear a little bit louder. Good morning, Gainwell Technologies. All right. Good morning, Department of Community Health. Yeah. Good morning, providers. All right. Good morning, CMOs. Good morning. All right. We heard a little bit. That's all good. That's good. And then good morning to the vendors that's probably out in the back. Good morning to each of you as well. Good morning. All right, cool. All right, thank y'all so much for that. I really appreciate it. One of the things I wanted to make sure is that we got everybody energized and ready to go for today. We have a lot in store for you today, and we want to make sure that you are super excited, you're energized, and you're ready to walk the paths to the power of knowledge that you're going to gain today. So before we get started, I'm going to talk about the spring Medicaid sessions that we have lined up for you today, just so that you can kind of think about, what do I want to go to today? What do I want to see? What do I want to hear? What do I want to know about? And so to start with, we have the opening session, which you're here today, right now, to hear myself and Mr. Grant Thomas from Department of Community Health. So thank you for being here. And that's from 9 to 9:45. And then from 9:55 to 10:55, we have demystifying OIG claim audit in Ballroom D, as well as Peach State right here in this auditorium. And then at 11:05 to 12:05, we have current trends in pharmacy spending in Ballroom D as well. And Care Source will be right here in this auditorium. Then we're going to break for lunch that everybody wants to go do, I know. 12:05 to 1:05, that's the lunch break. 1:15 to 2:15, we're going to have maternal health focus, Ballroom D. And then, of course, AmeriGroup will be right here in this auditorium. And then at 2:25 to 3:25, we're going to wrap it up with DCH Q&A, and it's going to be right here in this auditorium. So we have a packed-filled day for each of you, and we are excited about you being here, and we are ready to get started. So one of the things I want to do before I actually kind of go into some of the metrics and things of that nature is I want to highlight one of the important banner messages that DCH has put out on the web portal. So as you all know, they put out a lot of banner messages to make sure that you're informed, to make sure that you know what's going on, to make sure you know the different policy changes and things of that nature have occurred. One thing that we want to make sure that everybody is super aware of is the provider group enrollment webinars. They have already started. We posted it on our web portal on early March 1st, and they're going through May 15th. It is super important that you all sign up for these so that you can gain the intellect that you need for this particular process. They're going to cover a number of topics. One being enrolling your group practice to affiliate your rendering provider, viewing and maintaining the data for rendering providers, billing and taxonomy requirements, submitting claims for rendering providers, EDI claim submission, and EOB denial edits. Definitely make sure that you sign up for one of these webinars because it is going to be information packed, and we want to make sure that you are completely aware of what's in store for you going forward. Now, the time that I always love is the introduction of the provider relations team. This team is the team that actually puts this event on twice a year prior to COVID, and it takes a lot of work and effort. And team, I want to say thank you for your hard work that you do every single day. For those of you that have been here with me before, you've heard me say that the provider relations team is the bridge between the Department of Community Health, Gainwell, as well as the provider community themselves. And without them, we wouldn't be where we are today, right? The thing is that they take the time out of their busy schedule each and every day to make sure that we're tooling the providers with the right information that they need to be able to serve the Medicaid members of the state of Georgia. Our providers are the unsung heroes for us, Because right now, every single day, they navigate complex problems, they build relationships, they navigate day in and day out those things that you never could think of. And I'm so proud of the work that they do. They are problem solvers. They are advocates and connectors. Like I told you, they're the bridge between all of us. And it takes all of them to do what they do every day. And balancing the needs of the providers is what makes us great. And I really do appreciate them. What I'm going to do is allow Sharona Strong, which is the supervisor for this group, to come out and introduce them at this time. Thank you, Sharona.
I hope you can hear me. Sorry, y'all. I'm just gonna hold it. How about that? Can y'all hear me? Yay! Well, as she stated, I am Sharona Strong. I am the Provider Relations Supervisor, and it is my pleasure to introduce you to my amazing team. We'll start with Territory 1, which is North Georgia, Mercedes Liddell. Territory 2, which is Fulton, DeAndre Murray. Territory 3, Northeast Georgia, Carolyn Smith. Territory 4, Northwest Georgia, Tiara Johnson. Territory 5, Southeast Metro, Ebony Hill. She's not with us today, but she's here in spirit. Territory 6, which is Middle Georgia, Shantil Bradshaw. Territory 7, my old territory, Bishop. Okay, sorry, is Augusta, Jessica Bowen. Territory 8, Southwest Georgia, Jill McCrary. These are people. Territory 9, Southeast Georgia, Kendall Telfair. Territory 10, South Georgia, Anitra Johnson. Woohoo! All right, and it is, we have we have one hospital position that is vacant, used to be held by Janie Griffin. She has now transitioned to another position. And then Sharita Bentley, who's not here with us today either. And, and it's my pleasure to introduce some of our in-house staff. We have Chastity Barrett. She's not here with us today. I have quite a few people not here today. Crystal Gordon is not here with us today either. We have Haley Guyton. She is here with us today. Yay! Brandon Stewart. And then I also have Kaylin White and Latanya Durden. Neither are here with us today. And it is my pleasure also to introduce our statewide consultants. So when one of these lovely people are not available, we'll send one of these others out if you need immediate assistance. So we have Brenda Hewlett, Danny Williams, Janie Griffin Weaver, and then our provider enrollment, CVO, field rep. So if you're having concerns when you're doing your application processes, this is who you'll see. We have Darlene Bonner for the South, and Aubrey and Woods Hawkins for the North. And this, my fabulous provider relations team. Yay!
Absolutely. This is the amazing, wonderful provider relations team. Thank y'all so much. Thank y'all, thank you. Now, I know y'all are used to having the abracadabra move where they come on stage and they leave. We want them to be engaged today. We have a few questions for them today. So could you get the mic, Sharona? Right there. One of those up there. So we want to hear from you, right, specifically. I'll call Sharona first, so she wants to talk. All right, Sharona, I have a question for you. What are you most proud of when you look at the work that your team does to support our providers and members each day?
Well, I know what it takes to do what they do every day because I used to be a field rep. So I know what it's like to go into offices and have to speak with people face to face and be put on the spot, basically, with any questions or concerns that they may have. And I think they do an excellent job of addressing everybody's concerns. I think they work above and beyond to make sure that they're getting good information, they're accurate, they research it, they make sure that they're telling the people what it is. It may not always be what they want to hear, but they do work really, really hard to make sure that they're getting good information and trying to tackle all the day-to-day concerns that they may have.
Thank you so much. I really appreciate that. Anitris. Why do you do what you do every day? Thank you. Brandon, what keeps you motivated to serve the provider community?
Moments like this. We see the providers testify, see how they're dealing, help them with their dealing, and they're helping members, so we help them as well.
All right, all right. Miss Brenda. Brenda. What does being a part of this provider relations team mean to you personally?
Being a part of this team is really amazing because we do work as a team and we know that we have your back, we have your back. It's really important to us that we make it as easy as possible. I know it's not easy sometimes the provider, the members. Sometimes it's the most vulnerable in our society. So we want to do it and step up if you see your members and provide services.
Thank you. And Miss Darlene, what's one thing about your role that brings you the most pride? What's one thing about your role that brings you the most pride?
One thing about my role, although there are many, but one thing about my role that really inspires me are my clients. I'm on one-on-one relationships with them, and I believe that we have a relationship that entrusts me to do what I say I'm going to do, even though it may not be on the spot, but I'm going to find what needs to be done to support and keep my providers informed about what's going on with Medicaid. And so, like I said, I think I'm on one-on-one relationships with quite a few of them, and that's what inspires me about what I do every day. And I do it with an effort to make sure that you guys, my providers, because you guys are the ones that keep me here, believe it or not. So I appreciate all of my providers all the way around. Just great to meet you.
Thank you, thank you, thank you. Thank you, team. I just thought it was super important that they heard from you all, right? They see you, but I wanted them to hear from you all because I thought it was important that you express the passion that you feel each day working with each of them. And one of the things I want to say to each of you, I know I say it in our meetings quarterly, but the reality is I want to make sure I say it in front of this team. You all are the foundation of our success. I appreciate everything that you do day in, day out. I know putting on this Medicaid fair is a hard thing, but you guys do a phenomenal job every single year, every single time we put it on. And the reality is that you're there to support and serve the providers and serve and support DCH. And that's what's important to me. That makes me keep going each day because I have a team like you that will go above and beyond to do what it takes to make sure that we're all successful. And I appreciate you for your dedication, your resilience, and your commitment to excellence. Thank you, team. Thank you, thank you, thank you. All righty. Now that we've gotten that out of the way, let's talk about one of the enhancements that we've added to the system since the last time that we were here. Not sure if you all know, but DCH requests that we have general and targeted surveys to be sent out to our member population. And those surveys in the past were done all manually. What we've done is we've automated that process now, and now the survey can be completed on the web portal. All of the results are centralized and they're done automatically, so we've removed all of the manual effort out of the way. So I'm super excited about that enhancements that we've added to the system. I know we're gonna continue to enhance as we hear from each of you, as we hear from DCH, as we hear from the member population. We're gonna do what it takes to make sure that we're going above and beyond to meet the needs of each of you. Now let's talk about the metrics. Metrics is something that everybody loves to see, especially when you want to determine how we're progressing. And so there's a lot of metrics that's going to be on the screen. I'm not going to go over all of them because you guys can actually read the screens, but I will call out a few of them just because I think it's super important that each of you see those metrics and hear for yourself what we've done from a Gainwell perspective. One of the things I want to call out is the provider relations team, the team that was just up here. They've done over 8,500 provider calls, which includes emails, phone calls, virtual workshops, and virtual visits. That's a lot. They've been all over this state. So thank you, team. As it relates to the provider services call center, we've had over 512,000 calls taken in that call center since October 1 through March 31st of 2025. So it's not a year, it's just for a few months. And then, of course, in our Georgia Family Call Center, we've had over 118,000 calls in that particular call center as well. Moving on to provider enrollment, what is super important right now is that we are currently processing within 8 days of receipt, and CVO is at 19 days of the 51-day SLA. That is absolutely amazing. So we're trying to get it done as it comes in. We're trying to process very timely, and we appreciate you all with your patience, but we are actually meeting the SLAs, beating the SLAs, and that's something that I'm super proud of the team about. As it relates to rezo and adjustments, we are currently processing adjustment requests received within 9 days out of the 30 days allowed, and we have had over 2.4 million outgoing letters. That's a lot. That is a lot within that short time period. And so if you thought about our totals for the entire year, it's of course way more than that. But I just wanted to go over a few of the metrics that we had today before I transition into what I love to talk about, and that's teamwork. For anybody that's been with me, that has heard me speak, I talk about teamwork. Teamwork is the key to success. None of us could do it alone. It takes each of us to do this each and every day. And the reality is we have the passion to make sure that we're making a difference for the Medicaid members of the state of Georgia. And I can't say enough that I thank you. And I know those words can go and people think this, it's just a word, but it means a lot when people are working hard like each and every one of us each and every day to try to make sure that we're providing the adequate services to our members. And I appreciate you. But it does take the providers, right? I see the providers as the front line to healthcare. And then we have, of course, DCH. DCH, you're the backbone of Medicaid. And I truly mean that. You're the backbone of Medicaid. Gainwell Technologies, you've built this complex system. You're providing exceptional service. So thank you for your service. CMOs, you're improving lives each and every day. And we appreciate you. Thank you very much. Vendors, thank you for your collaboration. Teamwork is the key to success, just as I said earlier, and it couldn't be truer today. Because the reality is that what we have achieved together is a testament to the power of collaboration. So thank to each and every one of you for making that possible. The reality is that it is our continued dedication and teamwork across all of us that allows us to navigate challenges and push boundaries in delivering exceptional services to our members of this great state of Georgia. It takes all of us to reach success. So thank you again for all that you do each and every day. I will continue to say that. When I see you throughout the halls today, I'm going to tell you thank you, because without you, we wouldn't be here today, and I appreciate each and every one of you. Now, just a few reminders before I take my seat, that this presentation will be uploaded on the GAMIS web portal by the close of business tomorrow. The session FAQs will be uploaded within 2 weeks. So in case some of your counterparts weren't able to listen today, they'll be able to see the information, and we'll have it uploaded on DCH website as well. For access to the presentations and FAQs, please visit mmis.georgia.gov and go to provider information and provider notices. The next thing is provider banner messages. As I showed you one this morning, there's a lot others out there on the web portal. Definitely make sure that you take a look at those banner messages. DCH work hard to make sure that you're informed. And they put those banner messages out there to make sure that you have the right information that you need to be successful. So take a look at those at the mmis.georgia.gov site. If you want the DCH newsletter, make sure you go to dch.georgia.gov/dch-i, and you can subscribe or request to be added to the DCH-I distribution by using the link or the email below. So as I wrap up, I just want to say, let's celebrate the collective effort that we've all made together. Let's make sure that we stay committed to providing quality services to the members of the great state of Georgia. But it's going to take each of us. It's going to take each of us to do what we need to do to make sure they're getting the services. While I know it's challenging sometimes, I get it, I understand. But the reality is that if we didn't have the passion to do what we do, we wouldn't be here today. It takes passion, it takes commitment, it takes dedication to do what we do every day. And I appreciate each and every one of you. Thank you again for everything that you do every single day in making a difference. Thank you. So with that, I'm going to transition to Mr. Grant Thomas, the Deputy Commissioner.
Okay, can everybody hear me? Okay. Thank you, Talisha and the Gainwell team for hosting this Medicaid fair. We greatly appreciate our partnership with you all and everything you do to help administer our Medicaid program. Also wanted to just, before I start my presentation, thank all the providers who are here today. We know that, that we could not administer our Medicaid program and provide needed quality healthcare services to Georgians without all of you who work so hard to provide high quality healthcare to this population. So thank you for what you do, and thank you for being here today. I know it takes time away from your work, so we greatly appreciate our partnership with you all and being here today. Also wanted to thank our Medicaid managed care organizations, AmeriGroup, Peach State, and CareSource. We appreciate the partnership that we have with them and for them being here today. And last but not certainly not least, wanted to thank our DCH team who goes above and beyond to work for our Medicaid members every day, specifically all of those in the Medical Assistance Plans Division who are here today. Also wanted to take a moment and recognize Dr. Dean Burke, who is here. He is our Chief Medical Officer. So he's waving over there. Introduce yourself to him if you have not met him yet. And also Commissioner Russell Carlson is here. So we wanted to thank the Commissioner for being here and everything that he does to provide leadership for not only the Medical Assistance Plans Division, but all of the Department of Community Health. So our purpose at DCH, shaping the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities we serve. The vision of the MAP division, which is the Medical Assistance Plans Division, is a member-driven payer of high-quality, cost-effective services utilizing innovation and accountability to promote a culture of excellence. Now we are going to test my tech savviness by pulling up the poll. Okay, if everybody could take out their phones and go to menti.com. It's right there at the top, menti.com. And once you get to that page, you will enter in this code 3804-1399. Again, that's right up there at the top, 3804-1399. I'll give everybody a moment to pull up that page and enter in the code. Okay, we're going to take two questions on this poll. The first one is, which aspect of Medicaid policy most affects your ability to deliver quality care? We have reimbursement rates, utilization management and prior authorization requirements, patient eligibility and enrollment issues, looks to be an early winner, and then we have administrative burden and paperwork. Votes are continuing to come in. Great. Well, I think we get an idea there of the response. It looks like patient eligibility and enrollment issues is the aspect of Medicaid policy that most affects your ability to deliver quality care. And I want to note, looks like in last place, administrative burden and paperwork. I want to give credit to the Gainwell team, who does a great job making that process as easy as possible. So thank you all for giving your responses there and showing some insight. This is very helpful feedback to DCH and also the other team members here. So the second question is, what makes you proud to be part of Georgia's healthcare community? First option, our dedication to patient care, innovation and leadership in health policy solutions, strong community partnerships, workforce development, resilience and teamwork in challenging times. Okay, great. Well, it looks like another clear winner there with our dedication to patient care taking first place. It's certainly always important to remember the members and the patients that we serve. That is why we do what we do, to deliver health care to over 2 million Georgians in our Medicaid program. So with that, thank you all for participating in those polling questions. Do you know how to get it back on the... Oh, you just have to manually do it. Yes, perfect. Just when I thought I had succeeded with technology by operating the poll, I have yet to figure out the slideshow. But that's okay, here we are. So a quick overview of, the Medical Assistance Plans Division, which oversees our Medicaid program as well as our Children's Health Insurance Program, better known as Peach Care in Georgia. We have a small but mighty team in the MAP division with 140 full-time employees. We have 4 MAP offices within the division under 4 deputy executive directors. We have eligibility and enrollment led by Rebecca Duggar, performance and care management led by Dr. Kelvin Holloway. We have policy, compliance and operations led by Brian Dowd. and then Service Delivery and Administration, led by Deputy Executive Director Maxine Elliott. Just to give you a snapshot, the current enrollment and population that we serve in Georgia Medicaid today, it sits at about 2.18 million Georgians. It's been pretty consistent at that threshold since the PHE unwinding Medicaid redeterminations process took place from April 2023 through May of 2024. That was the 14-month period where all states and territories, including Georgia, had to redetermine eligibility for our Medicaid population after the PHE, that 3-year period where we were not disenrolling any members who did not do so voluntarily. And we saw our Medicaid population grow to about 2.8 million during that time. It now sits at about 2.18 million, and that is divided up between over 1.6 million members who are on Medicaid managed care plans, as well as about 570,000 members who are in our fee-for-service population. Combined federal and state budget for the MAP division is approximately $18 billion. So quick overview of some current initiatives that we are undertaking in the MAP division and at the Department of Community Health. The first here is improving member experience during the eligibility process. So, we know from the polling that this is top of mind for you all as well. Our eligibility and enrollment process, making sure that it is streamlined, that the members are able to navigate that process and are able to, if they submit a Medicaid application, are able to have that Medicaid application determined in a timely fashion and have it to where the members have a good experience doing so. So a couple different initiatives in the works related to that. We have been reviewing all of our policies and procedures regarding the Medicaid eligibility enrollment process to make sure that they are up to date, that there's not more flexibilities or that there's not a federal minimum standard that we can go to. If we are requiring something more than the federal government, we want to know why and have justification for it and to consider that. So we're really looking at our policies and procedures, again, doing a deep dive there. As many of you know, we have two agencies that, one agency in addition to ours that oversee the eligibility and enrollment process. We delegate the responsibility of the actual casework, of the actual operations of determining eligibility to the Department of Family and Children's Services, DFACS, which is under the Georgia Department of Human Services as one of their divisions. They are the ones who actually employ the caseworkers and oversee the operations for the casework. We, of course, have a very close partnership with them in administering that as we set the policies and work with our technology integrated eligibility system vendor, IES vendor, to administer and oversee that work. So we're also looking to see, as part of our review of eligibility and enrollment, to ensure that we are maximizing technology, maximizing automation when it comes to processing applications. So there are a lot of resources and databases that provide information on individuals applying through the Department of Labor. There's an interface with Department of Labor wage data. There's also other entities that have data, income and wage data, and so a lot of work can be done through automation, technology and automation without the member having to submit anything or very minimal documentation required for the member. And we saw this through the Medicaid redeterminations process, Medicaid unwinding, where our ex parte rate, which is basically automated verification, automated eligibility assessment that's done got up to about 60% of all renewals by the end of the Medicaid unwinding. And we did that through several different ways. We were able to align SNAP and TANF renewals with Medicaid renewals, and to use information from those other programs to help determine eligibility for Medicaid. And we're also able to, like I said, look at those databases and make sure that we were maximizing automated income verification. So that work continues. And then we're also looking at system enhancements, ways to make Georgia Gateway, the integrated eligibility system, better for our members, and really make sure that we look at that with a human-centered design, and make sure that, what the members are seeing makes sense and is easy to navigate. So we're also looking at some enhancements there. Moving on, PACE. This is the Programs of All-Inclusive Care for the Elderly. We did a presentation, I believe, last year on PACE at the Medicaid Fair last March, in March 2024. And this is a program that we are very excited about to be bringing to Georgia. About 32 other states have PACE programs. So this is something new to Georgia. Something that we have not had before, but a lot of southeastern states, all the southeastern states around us, have at least one PACE program in those states. This was first in the budget in the 2023 legislative session, the FY 2024 budget. We were directed as an agency to do a needs assessment. We did that needs assessment, and then in the 2024 session, House Bill 1078 passed and was signed by the governor, which authorized the Department of Community Health to establish one or more PACE programs in the state. We also, as part of that budget in the 2024 legislative session, there was funding appropriated for a grant program, up to 4 grants of $500,000 each for interested PACE providers. And so we put out that grant application and awarded those funds to 3 different providers. And now we are in the process of an open bidding process procurement for PACE providers across the state. So that was released earlier this month, and so we are receiving submissions now for those PACE providers, but very excited to be bringing this program to Georgia. It essentially provides another another option for individuals who require skilled nursing facility level of care. And the great thing about it is these individuals are able to be served in the community. They live at home, but these PACE organizations and PACE programs establish facilities where the members go several times a week. Interdisciplinary teams help manage the Medicaid, our coverage for these individuals. It actually combines Medicaid, Medicare funding in order to do that, and is for individuals 55 and older. So there's a 3-way agreement between the state, CMS, and the providers. So that process is underway. Again, we're accepting submissions for those interested providers now. We've got locations identified across the state. I believe it's 14 locations in areas across the state. So we've received a lot of great feedback from providers who are very interested in potentially providing this level of care and service, which will just increase options and provide additional options that are not available today. Another priority for the MAP team is behavioral health. This is both settings and services. So a lot of work has been done in the state on mental health, behavioral health, substance use disorder over the last several years. And certainly our team is very focused on this as well. House Bill 1013 passed in the 2022 legislative session, which was a comprehensive mental health bill, and DCH certainly had several different components in there that we were charged with administering and implementing. Mental health parity, for one, that has been a big focus, ensuring that mental health services or are available to the extent that physical health and services are available, and that individuals that there's parity for individuals there when seeking mental health services, just like when they seek services for their physical health. So we have a complaint portal online now, a lot of information on our website to help educate providers and the public about mental health parity. We are also exploring additional settings and different care models for behavioral health and mental health. We are actively working on establishing qualified residential treatment programs, QRTPs. There was legislation that passed during the 24 legislative session regarding this, and we have been, received board approval and have been working to submit our state plan amendment to implement that program. We're also working on a therapeutic care model, and I would say we're also identifying other opportunities to increase our mental health and behavioral health providers. Sometimes that comes from feedback that we receive directly from the provider community. For example, I believe it was a year or two ago, we received a lot of feedback from the FQHCs, the federally qualified health centers, who said, we have licensed professional counselors who we'd like to, serve our, the Medicaid population. That expands options for us to provide care and services to our Medicaid members, but they were not approved under Medicaid at the time. Licensed professional counselors practicing in a FQH setting were not approved for Medicaid reimbursement at the time, so they were able to bring that to the state's attention, and last year we received a state plan amendment approval from CMS for LPCs to provide care to Medicaid members in the FQHC setting. So a lot of examples like that where we're identifying new provider types and flexibilities that can allow for the delivery of behavioral health care. Next, the case management system updates. That is underway. And that really is focused on providing, case management and coordination for individuals in our waiver populations, so elderly and disabled waiver program, the independent care waiver program, ICWP. So that work is well underway. We are also very focused on chronic disease management. There's an ongoing focus on managing chronic disease in Georgia, and so whether that's heart disease, diabetes, other chronic conditions, Georgia has opportunities to do more in this space. We are actively working with providers, the CMOs, and community partners to improve health outcomes and focus on how to achieve outcomes, not just the process improvements. So really looking at those target outcomes, those metrics, and focusing on managing chronic disease. We are also focused on reducing maternal mortality and improving maternal health. So this has been a big focus for the state over the last several years. Dr. Burke has done great work on this, as well as other members of our Medicaid team. The state provided several years ago, I believe it was the 2022 session, coverage for up to 12 months postpartum for pregnant women, Medicaid coverage for 12 months postpartum, and we were one of the first states to adopt that 12 months when it became a state plan option for all states. And so providing that coverage was a very important first step for our Medicaid members, but there is more work to be done to make sure that those individuals can become enrolled in Medicaid and that they know about that coverage option, as well as making sure that we connect those Medicaid members with services that they are eligible for. And a lot of good work is going on at the department, with the Department of Public Health as well on that. So more specifics on maternal health, undertaking efforts to improve care are ongoing. Like I said, regular coordination is occurring with the Department of Public Health, DPH. DPH has undertaken over the last several years an in-home visitation program, and this year the governor recommended funding in his budget recommendation that the legislature approved to expand that program to additional counties. So like I said, having the Medicaid coverage for women up to 12 months postpartum is very important, but making sure they get those services is equally as important to delivering that care. And that in-home visitation program is able to serve members at their home and in the community when they may have obstacles or barriers to receiving care by providers or at different facilities. The state is also investing in perinatal centers, as well as offering incentives for providers for OB and GYN. We also have programs for rural providers. We know that's an important constituency, and always looking for ways to reach our members in rural areas of the state. We are also increasing our focus on the mental health of new moms. We know that can be a challenging time sometimes, and certainly want to manage the physical health post-pregnancy, but also mental health and any issues that arise there. We are also working to build off of successful models of care that have been piloted in Georgia with cardio, OB, and the use of paraprofessionals is also increasing. Wanted to provide an update on the Georgia Pathways program. This is a program that was part of Governor Kemp's Patients First Act initiative, which included 2 waivers that the state submitted to CMS. One called Georgia Access, which is a reinsurance program for the private marketplace to help make coverage more affordable on the marketplace, as well as a state-based exchange. So now individuals enrolling in individual marketplace insurance in Georgia enroll through the marketplace on georgiaaccess.gov instead of on healthcare.gov. And then the component the Georgia Access is overseen by the Department of Insurance, Commissioner John King, and then the portion that we are responsible for at DCH is the Georgia Pathways program, which offers coverage to individuals 19 to 64 who have not previously qualified for traditional Medicaid up to 100% of the federal poverty level. And 100% federal poverty level is a very technical term, and it basically looks at income and family size to determine if someone is eligible. For one individual, 100% FPL, so for one individual applying for Pathways or in Pathways, they would have to be at or under $15,650 a year in annual income, and then for a family of 3, that would be $26,650 a year. And so this has really offered a new coverage opportunity, like I said, to individuals who did not have anywhere to seek healthcare coverage previously. If they were under 100% FPL, they could not get subsidies on the Georgia Access Marketplace to get commercial insurance. Basically, anyone who's over 100% FPL can get very generous subsidies or subsidized coverage on the marketplace, and so they have an option. Then folks that were under 100% FPL, unless they were a pregnant mother or a child or a relative caregiver up to a certain income level, they have not been able to have health care coverage before. So this program, the Georgia Pathways program, launched in July of 2023. So the program's been in operation for over a year and a half now. Since the program started, there have been 11,400 individuals who have been served by the program, and current active enrollment is about 7,400. And so really the purpose of Pathways is to provide a coverage option in the continuum along with traditional Medicaid and with the Georgia Access program to make sure that we are able to offer coverage to Georgians, depending on their income and family size. And it's really with the goal of, there's a qualifying activity requirement where individuals are required to either work, volunteer, attend school, enroll in a job readiness program. Several other qualifying activities are acceptable as well to really help set them on their path to financial independence, to help them get connected with different activities and work-related activities, so that hopefully that pathways can then be a transition point for them to enroll down the road in either employer-sponsored insurance or in private coverage on Georgia Access. Talked about the growth in monthly enrollment that we've seen. We have embarked on marketing and outreach campaigns since August of 2024 for Georgia Pathways. You may have seen some ads on social media. We are running ads on Google search engine optimization, also on streaming, transit, trying to reach Georgians who may be eligible. The marketing outreach campaign is not trying to reach every Georgian. There's 11 million people in the state, and only a small fraction of those are, fit the age and income requirements for pathways. But we are strategically targeting those individuals to make sure they're aware of this new option that Georgia has for the first time. We are also getting very specific in our targeting to text and email individuals who we think may be eligible. So there's, individuals who are parents of children on Medicaid, but they are not enrolled in Medicaid themselves. So we can see through their income and their age that they may qualify for Medicaid. So we are outreaching to them. We are also, looking at certain transitional populations, women who are coming up to 12 months postpartum of their pregnancy, to target and outreach to them, let them know there's a coverage option after that 12 months. Children turning 19 who will be aged out of the Medicaid they've been on as a child, letting them know about pathways. We've really seen a lot of interest and uptake from college students for the Pathways program, because oftentimes they fit the age and income qualifications and are enrolled in a qualifying activity by being in higher education. So we're really working to identify those populations. Also looking at individuals enrolled in SNAP who may meet age and income for that program, but not be enrolled in Medicaid yet, letting them know about pathways and encouraging them to apply. So it's been very valuable having the help and assistance of providers like you all, but also Gainwell through their provider reps to let providers across the state know about pathways, as well as the CMOs have been very helpful to identify their current members who may be transitioning off their current class of assistance, to let them know about pathways, to help, we're also, the state is doing a lot of outreach to let family members, like I said, of children who may be on Medicaid, to let them know about pathways so that they can apply. I would say, another thing related to marketing and outreach is not just pathways that benefits from this marketing and outreach. It's also the entire Medicaid program. We've actually seen through the data that more individuals who apply for pathways, who submit a pathways application, end up getting approved for traditional Medicaid versus pathways. So we have more people submitting those applications that get approved for traditional Medicaid, because pathways is the last program on the cascade. So when it's the same application, it's just additional questions at the end of the Medicaid application. So when they submit that full application, they're actually screened for every other class of assistance before they get to pathways. And so I would argue that a lot of the work we've done on marketing and outreach has led to more individuals who qualified for traditional Medicaid all along, submitting an application where they might not otherwise have done so, and getting them enrolled in coverage. And that's really what we want. We want individuals in Georgia, Georgia citizens, to get connected with the healthcare coverage that they qualify for, whether that be traditional Medicaid, pathways, or Georgia Access with private insurance. we feel we have a good continuum there of coverage options, and so a lot of the work falls on the state to get out and educate and let people know about the coverage options that exist for them. Especially with the Medicaid population, we know this. There's a lot of churn, a lot of people coming on and off, income fluctuating. So we want to make sure people are aware of different options available to them. We are also, working on submitting a renewal application for the program. Again, this is a waiver program. We were given authorization for 5 years for the Pathways program by CMS. So the program expires currently on September 30th of 2025. We are working to submit an application to renew the waiver program by at least an additional 5 years. And as part of that, we've proposed several changes. The purpose of waivers is to test new and innovative ideas, and Georgia is the first state to ever, or to have an active, qualifying activity component to the program. So we've learned a lot through this waiver program and administering it. So a few of the changes that are in the waiver renewal application that will be submitted soon to CMS, it is transitioning from monthly reporting to annual reporting for Pathways members. So they will only have to report their qualifying activities once a year at initial application and annual renewal, just like when they report income or their residency, or have to provide that information. It aligns the qualifying activity requirement with all the other Medicaid requirements in the program. We are also adding 2 additional qualifying activities that the governor announced earlier this year. Parents and legal guardians of children under the age of 6, that will count as a qualifying activity now, and we know there are a number of those Georgians based on information we have in the system of children enrolled in Medicaid today. So those parents and legal guardians will have that option now, as well as individuals enrolled in the SNAP ABOD population, able-bodied adults without dependents. So if they are enrolled in that program and meeting a qualifying activity as part of SNAP ABOD, then they can use that as their qualifying activity for Pathways to help streamline and increase operational efficiencies there. We are also providing for retroactive coverage for Pathways members. So right now, when a Pathways member applies, their coverage is not active until the first day of the month after their application has been approved. This will now make their coverage retroactive back to the first day of the month in which they applied. So this should hopefully help get people the coverage that they've been approved for sooner. It will also hopefully help providers work with us to help identify these uninsured individuals or individuals who may be transitioning off their current healthcare coverage to apply for the program, because that would mean that they could get potential reimbursement if they're getting a service on the same day that they're applying for Medicaid. And so those are the main components of the waiver renewal application. Like I said, we are working to get that submitted and look forward to continuing to work on the program. So additional priorities for the MAP division: improving quality of care. CMOs are actively working to meet and frequently overperforming national benchmarks. So we're continuing our partnership with them to deliver high quality care to our Medicaid members. Quality and state-directed payment programs is also a priority. Those programs have been key and vital to helping enhance outcomes and increase outcomes and goals that the state has by providing those enhanced payments in exchange for meeting certain outcomes, be it on graduate medical education or different identified health outcomes for patients, and then also looking at quality in other payments. Like I said earlier, we're also working on implementing a new case management process and system for our elderly and disabled waiver populations, as well as home and community-based providers. And then also looking for opportunities to identify fraud, waste, and abuse in the Medicaid program. That is also a priority. So, several examples of this: proper billing by providers based on whether a Medicaid member is enrolled in a CMO or in fee-for-service. We also want to ensure that third-party liability is upheld so that Medicaid continues to be the payer of last resort. Data matching to ensure individuals for which claims are filed that the member is not deceased or living out of state. These are all real scenarios that require our attention and vigilance in order to address. Certainly with there have been instances of members out of state who are enrolled in 2 Medicaid programs. We want to work to address and correct that where appropriate. So a couple reminders before the opening session closes. Provider revalidation. Please remember to revalidate and stay current with your enrollment with the state as a Medicaid provider, and let us know if you have any outdated information or adjustments in your sites of service. The Gainwell team can certainly help with that work, and they do a great job in helping to work with you all and all of our providers across the state to make sure provider enrollment is current with up-to-date information is very important. And then please continue to speak to your patients who you think may qualify about pathways to coverage. So again, this can be uninsured individuals who are coming into contact with you at your facilities or practices. Please let them know that there's this coverage option available. Direct them to Gateway to apply, Georgia Gateway. And like I said, it may end up being that they're actually eligible for traditional Medicaid and didn't know. So by submitting that Pathways application, they may fall into traditional Medicaid or Pathways. And then also, if they're higher income and over that, there's also an option for them with Georgia Access and to receive a subsidized private health insurance plan. So lots of options. We want to make sure our uninsured folks are aware of those and connected to those different programs. We'll also say be thinking of anyone at your practices, any patients you have who, like I said, are pregnant mothers who may be approaching that 12-month postpartum period, or children who may be aging out, turning 19. Make sure they know about the Pathways program. Encourage them to apply as they approach those milestones to ensure that they have continuity of coverage and stay covered. So with that, I want to thank everybody for being here today, and look forward to visiting with everyone later. Please call on us at DCH and the MAP division if we can ever be of assistance or be helpful to you. Thank you all.
You go out there and get some knowledge today. Knowledge is power, and we're going to make sure that you are filled with a lot of it today. But before you leave, I want to leave you with this. So you always hear me talk about teamwork is the key to success, but it isn't just that. It's really the engine that drives better outcomes for our Medicaid members. And it takes each and every one of us to do that. So I want to ask that we stay connected. We continue to learn from each other. We continue to collaborate, because when we work together, our members win. Thank you and have a great day.